The world of weight loss medications has changed a lot over the years, and 2025 is no exception. New research, new medications, and new options are making it easier than ever to get a little extra help on your weight loss journey. But let's be clear right from the start, there is no magic pill. The foundation of any weight loss success is still diet, exercise, and lifestyle changes. That being said, medications can be an incredibly helpful tool when used the right way. So if you've ever wondered what medications are out there, how effective they are, and what you need to know before trying them, stick around. We're about to break down the top 5 weight loss medications for 2025, including the pros, the cons, the side effects, and costs. So let's get started. So let's start with one of the most well-known medications out there, and that's phentermine. This medication has been around since the 1950s and is primarily used as a short-term treatment for obesity, typically for up to 12 weeks, though some weight loss centers may use it for longer. It works by acting on your central nervous system to suppress appetite and increase energy expenditure. So think of it as a way to jumpstart your weight loss journey rather than a long-term solution. Now, phentermine can be effective in helping you lose weight. Several studies have shown that participants lost between 5 and 10% of their body weight over 12 weeks of use. However, while it's effective, phentermine does come with some potential side effects. The most common ones include increased heart rate, elevated blood pressure, insomnia, dry mouth, constipation, and nervousness. Because of how it works, those with certain conditions like coronary heart disease, uncontrolled high blood pressure, or hypothyroidism should be cautious in using it or avoid it altogether. So one of the best parts about phentermine is its affordability. Using a prescription discount app like GoodRx, you can often find it for as low as $15 to $20 a month, making it an accessible option for many people. However, remember that it's not a standalone solution. To see lasting results, you need to pair it with healthy eating habits and regular exercise. Next, let's move on to Orlistat. Orlistat is also known over the counter as Implied, and as a prescription, it's called Xenical. This medication works by altering fat digestion in your body. It prevents your body from fully digesting fats and keeps them from being absorbed. In fact, Orlistat can block the absorption of about 25 to 30% of the fat that you eat. It has been shown to be effective for weight loss in several studies. For example, in one meta-analysis of 12 trials, participants taking Orlistat along with a behavioral intervention lost an average of 8% of their baseline weight, compared to 5% in the placebo group over a 12-month period. It's also been shown to improve cardiovascular risk factors, including reduced LDL cholesterol, lowering blood pressure, which is also a nice added benefit. But let's talk about the side effects, because Orlistat is not for everyone. In fact, I honestly don't know anybody who really takes this for very long. To be blunt, the medication can have some very unpleasant side effects. We're talking oily stool spotting, gas with discharge, and even fecal incontinence, especially if you're consuming a high-fat diet. Now, these side effects are more common early on and tend to improve as you adjust your diet, but they can be quite unpleasant for most people. Orlistat can also reduce the absorption of fat-soluble vitamins like A, D, E, and K. So it's important to take a multivitamin at bedtime if you're using this medication. And also, rarely Orlistat has been associated with some liver injury or kidney issues, but these current occurrences are very uncommon. As for the cost, Orlistat is available both as a prescription medication, Xenical, and over-the-counter as Ali. Over-the-counter versions typically cost around $60 a month, while the prescription version Xenical can range from $200 to $700 a month. Next, let's talk about Qsymia. Okay, this is a medication that combines phentermine, which we already talked about, with an anti-seizure medication called topiramate. Phentermine works by suppressing appetite, and topiramate helps you feel fuller longer and can even reduce cravings. Studies have shown that this combination can be highly effective for weight loss. For example, in a trial of nearly 2,500 adults, participants taking phentermine and topiramate lost an average of 8 to 10% of their baseline weight over a year, compared to just 1.2% in the placebo group. In a 2-year follow-up study, participants were able to sustain significant weight loss compared to those not on the medication. Now, like any medication, phentermine and topiramate combination comes with some potential side effects. The most common ones include dry mouth, constipation, and a tingling sensation in the hands or the feet. It can also cause dose-related issues like mood changes, anxiety, or difficulty concentrating, so close monitoring is important. Now, for women of childbearing age, there's a high risk of birth defects, so you gotta use some sort of reliable contraception and regular pregnancy tests if you're gonna be taking this medication. Phentermine-Topiramate is not recommended either for people with certain conditions like glaucoma, hyperthyroidism, heart disease, high blood pressure, or a history of kidney stones. If you're considering this medication, it's important to talk to your doctor to determine if it's the right fit for you and to understand how to safely start as well as stop the treatment, because the abrupt withdrawal of topiramate can lead to seizures, so the dose needs to be tapered off gradually. In terms of cost, phentermine and topiramate that is combined in one pill can be had for around $150 a month. However, one way that many can get around this and get it cheaper is by prescribing generic phentermine and generic topiramate separately, although doing it this way really has not been fully studied. So talk to your doctor to see if this might be an appropriate approach for you. Now let's talk about another one called Contrave. This is a combination medication as well, but it brings together two drugs, naltrexone and bupropion. Naltrexone is commonly used to treat alcohol and opioid dependence and as an antidote for opioid overdoses, while bupropion is often prescribed for depression or to help with smoking cessation. Together, these medications target specific pathways in the brain that regulate appetite and cravings, making Contrave a unique option for weight loss. Studies have shown that Contrave can help people lose around 4 to 6% of their baseline weight over the course of a year. For example, in a randomized trial, participants taking Contrave lost an average of 6% of their body weight, compared to 1.3% in the placebo group. While it's not as potent as Phentermine-Topiramate or the GLP-1 receptor agonists, it can still be a helpful tool, particularly for people who struggle with emotional eating or cravings. As with any medication, there are side effects to be aware of. The most common ones include nausea, headaches, constipation, and insomnia. Other less common side effects include dizziness, vomiting, and dry mouth. One important consideration is that Contrave is not recommended for individuals with a history of seizures, bulimia, or alcohol withdrawal seizures, as bupropion can lower the seizure threshold. It's also not suitable for pregnant women or those with uncontrolled hypertension. When it comes to cost, Contrave typically ranges from $100 to $200 a month, although you can also prescribe the generic versions of bupropion and naltrexone separately in an attempt to reduce the costs. Finally, let's dive into the most talked about and frankly the most effective of the medications that are available today. These are the GLP-1 receptor agonists. We're going to focus on Tirzepatide and Semaglutide. Tirzepatide is approved for diabetes under the brand name Mounjaro, and for weight loss under the name brand Zepbound. Semaglutide is approved for diabetes under the name brand Ozempic and for weight loss Wegovy. The weight loss results from these medications are impressive. In one study, participants taking Tirzepatide lost an average of 15 to 20% of their body weight over 72 weeks. Semaglutide also delivered strong results, with participants losing approximately 10 to 15% of their baseline weight. Both medications are administered as a once-weekly injection, which is a convenient option for long-term management. As with any medication, though, there are side effects to consider. Common ones for both Tirzepatide and Semaglutide include nausea, vomiting, diarrhea, and constipation, particularly when we're starting to increase those doses. These gastrointestinal issues typically improve over time as your body adjusts. Now, some rare but serious side effects include pancreatitis and gallbladder disease, so these medications aren't recommended for individuals with a history of these conditions. Additionally, they're contraindicated in people with a personal or family history of medullary thyroid cancer or multiple endocrine neoplasia syndrome. Now for the biggest issue with these medications. If you're going to use Zepbound or Wegovy and pay for it on your own, you're looking at paying around $1,000 a month. Many insurances are not covering these medications yet for weight loss, but more companies are starting to include them in their coverage. So if you want to know if your insurance will cover it, reach out to your HR department and ask if your company has opted into covering these types of medications. For those without coverage, many people are turning to compounding pharmacies to get similar formulations. Compounding pharmacies create customized medications, often combining Tirzepatide or Semaglutide with other additional vitamins or other components to bypass those patent restrictions. While this can significantly reduce costs, often $200 to $300 per month with a prescription, it's important to know that compounded medications are not FDA approved. This means they don't undergo the same rigorous quality control as name brand versions, introducing potential risks regarding the production quality and consistency. If you choose this route, it's essential to weigh the benefits and risks and carefully consult with your healthcare provider. So there you have it, the top 5 weight loss medications for 2025. While these medications can be powerful tools to help you achieve your weight loss goals, it's important to remember that they're not a substitute for the hard work of maintaining a healthy lifestyle. Diet, exercise, and long-term behavior changes remain the cornerstone of sustainable weight loss and overall health. Medications can support your efforts, but lasting success depends on building habits that you can stick with for life. If you want to dive in a little bit deeper and learn more about the main 2 GLP-1 medications, I have one here on Zepbound and the other one right here on Ozempic. They'll help you understand a little bit better about what you need to be looking for if you're considering taking these medications. So thanks for staying with us here at Family Med. We want to wish you luck on your weight loss journey, and we'll see you in the next video.